All right. Good afternoon, everybody. Can everybody hear me good?
You're breaking up just a little bit, Lonnie.
Am I still breaking up? Sorry, they've got me down in this conference room.
That's better. You're not breaking up as much anymore, so right where you're at.
I'll get closer to my computer. That may help. Okay. All right. Does that help?
Yes, very much so.
All right. Good. Okay. Well, good afternoon, everybody. This afternoon, I'm going to be talking to you about the fraud side of Medicare. So if you're all doing any counseling or anything like that with any of your the Medicare beneficiaries, you never know when an issue like this might come up. So that's why I'm going to train you about the different types of fraud, the difference between fraud and abuse, and things like that, and how to report it. So of course this. Why is it not working? There we go. My office is in Cookeville, Tennessee. Here is ways to contact me. I've also mailed out to most of you the SMP Foundation Training Manual. Along with that is a manila folder with my card attached to it. There's flyers in there. There are a copy of the PowerPoint. There is a copy of the SMP reporting tool, and also a release of information. So I'll be talking about those a little bit later on. But my office is in Cookeville, but I do cover the whole state. So I do travel quite a bit. Like right now, I am up here in Gatlinburg. We just finished with the Tennessee Elder Justice Conference. So I had a booth set up there. So I travel around a lot. If you need anything, a good way to get in contact with me is by my email, because I can respond to emails. I can get my emails on my phone. But Tennessee also does have a toll-free number in case, it does cover the whole state, and it is toll-free. And it rings directly into my office. So the goals of the training is pretty much, I'm going to teach you about fraud, how to report it, and things like that. Of course, why SMP started is because Medicare loses $60 billion every year due to fraud, errors, and abuse. So, and there's approximately 250,000 Medicare beneficiaries are listed as having their medical identity compromised. So right now, what that means is that if someone has their medical identity compromised, it is either their Social Security number or someone else's Social Security number stolen. And if the scammers get a hold of these Social Security numbers, they can do all sorts of things with these Social Security numbers. Luckily, and I don't know if Sydney has talked about this before, Medicare is issuing new Medicare cards to all Medicare beneficiaries that does not have the Social Security number as the medical identifier. It's now going to be a combination of letters and numbers. And we just got word today they're actually they started mailing them out in April, and there were 7 different waves. And we just got confirmation today that, and of course Tennessee's in the last wave, but they will be starting wave 7 sometime in October. That's pretty much all that they have told us. But they are mailing them out pretty faster than what I thought they were going to. So the SMP mission and goal. Our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report Medicare fraud, errors, and abuse through outreach, counseling, and education. And it's the outreach, counseling, and education that I need help with, because I am just one person working the whole state. So I need as many bodies that I can get to help pass on the word of, don't fall victim to fraud. I teach beneficiaries and talk to them about not giving their information over the phone to anybody that calls them. And I need help with those outreach and counseling, or setting up booths just to make people aware of the SHIP and SMP program. because there's still a lot of Medicare beneficiaries out there that do not know about both programs. So how seniors can prevent fraud? They can actually prevent fraud by, not giving their Medicare number out over the phone. Luckily, with the new Medicare card, it's no longer going to be Social Security number based. So that's going to help with a lot of the identity theft. So I tell beneficiaries to treat their Medicare card like it is a credit card, because you don't want someone stealing your credit card and racking up charges. You don't need someone stealing your Medicare card so that they can rack up claims on your Medicare number. And it can also affect your health record. For example, I had one gentleman, he called me that when he pulled his medical records, he had on there a diagnosis of something he had never been diagnosed with. And come to find out, someone had been using his Medicare number for different types of claims. So it can actually affect their health record, which is not good. So how can they detect fraud? And I tell this to beneficiaries because a lot of them don't go through their mail, or they throw it around when they get it. I tell beneficiaries, please, 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 read your Medicare summary notices or explanation of benefits when you get them, and at least keep them for a year just to make sure that if you ever get a bill from a doctor or something, that bill and your Medicare summary notice match up. I tell beneficiaries, don't pay anything until you get your Medicare summary notice in the mail, or your explanation of benefits in the mail. The bad thing about the Medicare summary notices is that they only come out quarterly. So you kind of have to wait until, the doctor submits it to Medicare, submits the claim to Medicare, and then Medicare pays it, and then you have to wait like that quarter, like several months after the fact. So that's the only really bad thing about the summary notices coming in the mail. The good thing is that if they do go on, if beneficiaries are computer savvy, they can actually go on mymedicare.gov and set up their own personal account, have a username and password, and they can actually see their claims in real time. So if you have a beneficiary in your family, you can maybe help them set that up, or if it's a parent or something, they've given you permission to do that, you could set those up. That way you can see their claims in real time. Another thing, the explanation of benefits, that's the ones that usually the Advantage plans send out, and they actually come in real time, so they don't have to wait for them. So I encourage beneficiaries to please read those and keep records of, when you went to the doctor, what happened during that doctor's visit, things like that. Cause for example, I just had one referral not too long ago, and it was for blood work that the doctor had never prescribed some of these tests, but the lab had done some of these tests, and I got a copy of her medical records, and the doctor had never prescribed those tests, and now the lab was trying to bill her for those tests. So this is just some of the stuff that I get. So it's very important for seniors to keep records. It's very important for them to read their Medicare summary notices and compare those to their bills before they ever pay anything. And of course, ask questions. Ask the doctors. That's another thing that beneficiaries, I don't think, do a lot of, is they don't question their doctors. Ask them why you need this test. Is this actually medically necessary? Because Medicare will not pay for something if it is not medically necessary, backed up by documentation from that provider. So, and that's another thing, beneficiaries need to start asking more questions. Do we really need this? Is this necessary? Something like that to help cut back on the fraud. A good tool that I use, and I have these sent out to all the AAADs or all the ships. So everybody should have some of these. It's called Personal Healthcare Journals. Seniors like these because this is something they can actually use and keep track of when they went to the doctor, what happened at the doctor, if the doctor diagnosed them with anything, any test that was run or the doctor ordered, anything like that. So these are real handy. I hand these out at, senior centers, I hand these out at healthcare fairs, anything like that that I set up at, I hand these out. And up here at this conference, I handed several out to senior centers. There were some care coordinators, there was case managers up here. So I handed several of these out. I've even sent some to a doctor's office before. So if you all need any of these, get with your local SHIP program coordinator, and they can give you some to hand out in different places. So what if they do find something, or if you find something, the next thing is report it. It really needs to be reported so we can actually stop the fraud. The bad thing is that a lot of seniors don't know what to do if they do find something. They don't know what to do with it once they do find it. So that's why it's very important for us to get out there and educate the beneficiaries on what they can do if they do find a discrepancy on their Medicare summary notice or the bills. And how they can report it is give them my toll-free number, or you get their information. I need their name and phone number, address kind of thing, just so I can do the referral. And either you can contact me, phone, email, however, fax, it doesn't matter, as long as you get it to me, and then that way I can start the referral process and get it, all the information gathered together so that I can report it to the Office of Inspector General for fraud, or if it's a billing issue, maybe work with the provider and get that issue taken care of. But the thing is to report it, because we can't do anything about it if we don't report it. And according to Congress, senior citizens are our best front line of defense against Medicare losses, because, you know, they're the ones that get these summary notices and things like that. Yet they don't have the information or expertise needed to either recognize, or they don't know where to report it to. So it's very important for us to get that education out there. There is an SMP in every state and territory, like SHIP. We are both funded through the Administration for Community Living. That's a test question. So yes, ACL for short, so U.S. Administration for Community Living. SMP actually started as, you know, like in '95 of how can we stop these Medicare losses. And in '97 it started with 12 demonstrations, and those 12 demonstrations actually saved so much money that in 2003 we went nationwide, and of course today we have one in every state and territory. And we actually have a national kind of like an SMP call that we do monthly with everybody on the call at one time, so we can pass you know, information together, or, you know, tips or anything like that. It's a real handy thing. So SMP is actually grant funded. My grant money comes from the Healthcare Fraud and Abuse Control Program. That's where my grant money comes from. And it's funneled down through the Administration for Community Living. And there's two different things that support, of course, the SMP grants. And SMP also has a national resource database for SMP. And we also have a SMP data reporting system that is supported by this and any of the support services. So that we know that one of the most effective and direct steps we can take to improve Medicare's long-term health is a program of waste, fraud, and abuse. And for the last 14 years, the Senior Medicare Patrol has been on the front lines of that fight. So, and this was from our former Secretary, Kathleen Sebelius. Now, three roles of the SMP is to disseminate information. That's kind of like something that I've done for the past couple of days since I had a booth set up here at this conference. The next one is assist beneficiaries in resolving issues and complaints. Now that is the counseling side of it, where I need assistance with you talking to the beneficiaries and letting them know, or helping them gather up all their information or anything like that. So that is the counseling part of it. And the next role that SMPs do is refer suspected cases of fraud, waste, and abuse to the appropriate investigative entities. Now, keep in mind, I am not an investigator. I do not investigate these frauds. I just gather all the information that we can get, and then I pass it on most of the time to the Office of Inspector General. That's who I usually hand all my fraud referrals to. Of course, it's, I am, we are accountable because we do have grant funds. It is federally grant funds, so I am accountable to ACL and OIG and, of course, taxpayers because I am federally grant funded. And program accountability, there is a report that I have to do every year, and it goes to the Office of Inspector General. And that report, it captures a lot of data. It captures all the outreach and education activities. It captures team members' time and effort. It captures pretty much all the referrals that I get. It captures everything. And my data system is called SIRS for short, the SMP Information and Reporting System. So it's called SIRS for short, and it's actually the new STAR system is based off of the SIRS system because it's the same people that built the STAR system also built the STAR system. Okay, the OIG report, I said this is what I have to submit to yearly to the OIG, and it encompasses pretty much everything that volunteers do, all your time and effort, all the outreach and any presentations you all do, anything and everything. It is in this system. All your training time, everything is counted in this system. So this is what our 2016 numbers for nationally were. Nationally, SMP had 6,126 active team members. We had over 26,000 group and outreach events. We had over 195,000 individual interactions. Cost avoidance on behalf of Medicare, Medicaid beneficiaries, or others was over $163,000. There was over 53,000 total savings to beneficiaries, and expected Medicare recoveries was 2,672. That was in 2016. Here's my numbers for last year, for 2017. SMP had 432 active team members. We had over 24,000 team member hours, so that's how many hours the volunteers worked. We had over 1,300 group outreach events. We had over 27,000 individual interactions. We had over 62,000 in cost avoidance on behalf of Medicare and Medicaid beneficiaries and others. We had over $304.56 in expected Medicare recoveries. I saved beneficiaries $425. Now that's actually money I actually got back for a beneficiary. And so total savings was $729.56 for last year. So I'm pretty proud of the cost avoidance for last year for me, and I'll explain what that one was a little bit later. So that's just why it's very important for the volunteers, and why we train as many people as we can get trained, is because it is very important. Because we have so many Medicare beneficiaries that we need to reach every year. So without that, it's going to be hard for us, to reach all these beneficiaries. And we can actually save beneficiaries money, or we can actually help beneficiary not have to pay a bill or something like that. So it's very rewarding where we can either save them money or get money back for them. I deal with a lot of the balance billing issues where someone's a QMB and a provider has tried to balance bill a QMB for that cost, that 20% that they're not supposed to balance billing for. I've gotten several money back for them where they've paid in thinking they had to. So just getting that education out there is very, very important, and we need as much help as we can get with that. So here's some of the roles that some of the volunteers can do, you as volunteers. Assist with administration, filing, answering phones, anything. Distributing information, we really need that. Get that information out there. Help us set up health fairs, even making group presentations. We've got some preset presentations that we can give you with already has the handouts and everything, and it even has a script that we can help, give these presentations to all these senior centers, because I know we can't reach all of them at the same time. There's so many senior centers out there. Next one is counseling. That's that one-on-one with them, either helping them pick out their plan or if they have any issues or anything like that. And the next step is, handling complex issues. If there's any volunteers out there that would like to help me with any complex interactions, please let me know. If you just love the fraud side and want to help me, with some of these cases, I'll be more than happy to hand some off to you. So how can the seniors find the SMP program? Of course, I do have the toll-free number. They can find us on the ACL's website. We're actually in the Medicare and You Handbook, and here's the resource center that I was telling you about. It is a national SMP resource center, and they can actually find my contact information on there. So there's pretty much chapter 1. So I'm going to go on to chapter 2. And this is talking more about Medicare statements and claims tracking. So pretty much the Medicare statements is that Medicare summary notice that I was talking about. Now, Medicare summary notices for people that's on original Medicare, they're called a Medicare summary notice. If someone has an Advantage plan or their prescription drug plan, they'll get something called like an explanation of benefits, summary of benefits. It's whatever the Advantage plan wants to call them. So keep in mind, if it's original Medicare, they'll have a Medicare summary notice, or MSN for short. If they're on an Advantage plan, they'll get an EOB in the mail. So, of course, what these documents explain is what the healthcare provider or the pharmacy billed for, like what service was billed, the amount that they billed for, the amount that actually Medicare approved. Now, you'll be surprised at some of those differences. How much Medicare actually paid and what the beneficiary might be billed. Now, keep in mind on the Medicare summary notice, and I'll show you one here in just a second. It says on the Medicare summary notice, this is not a bill. So I get several calls where, especially if they're QMB, I got this bill in the mail, and it says that I owe this much. When they start reading the document to me, it's the Medicare summary notice. It's not going to say what actually TennCare paid for, because they don't combine those. So as I was telling before, if someone went in, if they want to see their claims in real time, I highly encourage beneficiaries to sign up for a mymedicare.gov account. It's really easy. They can get their claims in real time. They can actually do a lot of things on that. They can check their payment status. They can check if they've met their Part B deductible, anything like that. So they don't have to wait for those Medicare summary notices to come in the mail. So how does seniors read a Medicare summary notice? And I don't know how many's on here has not seen a Medicare summary notice. I don't know if you can raise your hand as to who has not seen a Medicare summary notice. And there's two different types of Medicare summary notices. There's a Part A, which is the hospital, Okay, I got one person raised their hand that I can tell. Okay, there is two different types of Medicare summary notices. One is the Part A, which is their hospital. So it'll say on there, the hospital that they're in, their benefit period, how many days they have left, or how many days that they've used in that benefit period, how many days they've had left. And a Part B one is their medical insurance. So that's pretty much the doctors, the ambulance, the durable medical equipment, pretty much all that is under their Part B. Now, and they'll have two separate ones. They won't all come, they might get mailed at the same time, but there'll be two different Medicare summary notices. So here's what a Medicare summary notice looks like. As you'll notice at the top, what you need to notice at the top is this a Part A or Part B one? For example, I had a gentleman, he went in for a routine colonoscopy, an outpatient procedure. And after the colonoscopy, several months later, he got a Part A Medicare summary notice in the mail because the hospital where he had his colonoscopy done at charged him for an inpatient bed, even though he was there for an outpatient procedure. So that's why it's very important for them to read their Medicare summary notices. So next thing that they need to look at, of course, is their name, address. Make sure that the Medicare number is up here. It's only going to have the last four digits. You'll have the date of the notice, and it'll have the claims process between. So those dates are very important also. As providers have a whole year to submit claims to Medicare. So keep in mind, this claims process between may be, it could be 6 months ago, 9 months ago. So that's the claims process between. That's a very, so you need to look at those dates also to see when actually the provider submitted it to Medicare. It'll have the deductible status. I've even had to tell a couple of beneficiaries who did not know that they had a Part A deductible. I had to explain that to them also. Most people know that there's a Part B deductible, but there's some that did not know that there's a Part A deductible that they have to meet. Another thing to look at is, did Medicare approve all the claims, yes or no? If there is a no there on the right side, then Medicare denied something. So you may have to help them file an appeal as to why Medicare denied something. And then it'll have facilities with claims this period. It'll have the name of the facility that they were in and the dates that they were in that facility. So all of that should match up with their records. So that's why it's very important for them to keep records. So as you can see on page 2, it'll have a lot of information. Your benefit periods, especially if this is a Part A, you'll have inpatient hospital. It says you have so many days out of 90 covered day benefit days remaining. Skilled nursing, it says you'll have, whatever days out of 100, benefit days remaining. So that kind of helps let people know, and that's why it's important to see these in real time if you go on that mymedicare.com, because they may have used up all these days, but they're not going to get this Medicare summary notice till, who knows how long down the road. So here's page 3, and that can be multiple page 3s of the summary notice. So this is where it'll list the dates that they were in the facility, and the name of the facility, the address of the facility, who actually referred them. So that's pretty much the doctor that admitted them as an inpatient into the hospital. Now, and there's been I don't know if Sydney discussed with the difference between outpatient observation and inpatient. That's the very big thing. If someone is admitted for observation, most of the time they're been there as an outpatient, not an inpatient. So if they're in there under observation, that actually shows up under their Medicare Part A or Part B. not their Medicare Part A. It only shows up under their Medicare Part A if they're an inpatient in the hospital. So, and it should have here, you know, the doctor that puts them there as an inpatient. It'll have their benefit days used. It'll have was a claim approved or not, any non-covered charges, and there's several things that's not covered if they're in there under observation. And one of the big things that is not covered, that Medicare does not cover if they're in there under observation, is their medicine that they take by hand. Blood pressure medicine, those type of medications, Medicare does not cover if they're there under observation. So this will have the list of the amount Medicare paid and the maximum that they may be billed. Also, most of the time there's notes, so that you'll see these two letters over here on the right side of the Medicare summary notice. It'll have notes there. I highly encourage everybody to read the notes at the bottom, because you never know. It may say that, you know, they don't owe this amount, or this, you know, amount was sent to their secondary insurance, or, you know, something like that, their supplement, anything like that will be there. So I encourage you to read the notes. So if you have to help someone file an appeal, like if there was something that was denied, if there's a no, did Medicare approve all these services, yes or no? If there's a no there, then you may actually have to help a beneficiary file an appeal. And if they bring their Medicare summary notice to you, there is one very important thing that you need to look for. Look for that very last page. And I hope they haven't waited too long, because what you need to look for is the appeals must be filed in writing by. There is a date on the left of this page. It'll have the date that the contractor must receive that appeal by. Because if beneficiaries wait, if they don't read their mail, then they finally get a bill in the mail, and then they have to go hunt their Medicare summary notice, it may be too late for them to file an appeal. And I tell people this: if it is too late, go ahead and try anyways, because it never hurts. But the really things, Medicare doesn't have to look at those appeals if it's past this date. So just keep in mind, find that very last page. Also, if they need help filing the appeal, here's a step-by-step guide of how to file the appeal. So the first step is to circle the service that the beneficiary disagrees with. So go back through the summary notice and circle the service that that was denied, and then explain in writing why they disagree with that. And what I do with these is I type up something. Like, I have the beneficiary with me, and I type up what they pretty much tell me, and I have them sign that sheet of paper, because the explanation needs to be legible. That means the Medicare contractor needs to be able to read it, and so that they can comprehend it and then act on it. So step number 3 is, fill in this information. So fill in the blanks, and the beneficiary actually has to sign it, or the representative, if they have like a power of attorney or something like that. So they have to fill this out. Next thing is include any other information that would help the appeal. Any doctor's notes, anything like that would help, like a letter from the doctor, any other documentation that would help the appeal. For example, I just helped a beneficiary file an appeal not long ago. It was for this lab where the doctor only prescribed this certain labs, yet the lab performed more tests than what he prescribed. I had those notes that I submitted because Medicare denied some of those tests because they weren't medically necessary. So we also filed an appeal along with the fraud referral. So I submitted the doctor's notes that some of these tests weren't prescribed by him, and I submitted, and this is a thing. they had an advanced beneficiary notice of non-coverage, but it's not one that the beneficiary signed. Someone had written her name in the blank of where the signature was. So we submitted that because she actually signed what I typed up, and you could tell it was not her signature. So I submitted that. So I submitted all this extra documentation that would help the MAC on deciding on this appeal as to who is responsible for the charges on that. So next thing is I wrote her Medicare number on every sheet of paper that you're going to be sending in. And then I made a copy of everything that was being mailed in. And a good thing here on the very last page, it'll have the address that you're supposed to send that appeal to. So that's why it's very important to find the last page if you're going to have to help someone file an appeal. So I'm hoping I've walked you through how to file an appeal. Of course, if you all have any questions and you're having to help someone file an appeal, I'll be more than happy to help you with those, or word some stuff, or anything like that. If you have to help someone file an appeal, I'll be more than happy to help. Anything, give you directions on what more, documents together or anything like that. So here's what a Part B1 looks like. It looks very similar to a Part A1. So that's why it's very important for you to look at the top of, is this a Part A1 or a Part B1? So because they look very, very similar. And as you can notice in this example, Medicare didn't approve all the services. So we'll see what that one looks like. So what did Medicare approve or not approve? As you can see, Medicare did not approve the destruction of skin growth. So that's something Medicare did not approve. And here's the maximum they may be billed. And it says this service was denied. The information provided does not support the need for this service or item. So as you can tell, most of the time, if something was denied by Medicare, it's because the doctor did not provide enough documentation or something to support the need for that service, or something that Medicare doesn't cover or something like that. So that's why, of course, this is just an example. I don't know if Medicare does cover destruction of skin growth, for example, but this is just an example. Medicare may cover this. I don't know, but this is just an example of what the summary notices look like. And as you can see down here, it says see note B, and B says your claim was sent to your Medicare supplement. So that's why it's very important for beneficiaries to look at their Medicare summary notice, compare that. If they have a supplement, compare the Medicare summary notice and their supplement notice that they get, and any bill that might come in the mail to them. So it's very important for them to compare all those before they ever pay anything. And of course, page 4, as I said, is just filing an appeal, how to file it by. So I'm skipping a bunch of this. Okay, so Medicare rights and protections. I don't know if Sydney talked to you all about, I noticed earlier, I mentioned earlier that the advanced beneficiary notice of non-coverage. And that is a form that providers are supposed to give all Medicare beneficiaries if they know, and that's if they know that Medicare does not cover a service. It is something that they're supposed to have the beneficiary sign before they ever provide that service to that beneficiary. So, as I said, for example, in this lab one that I've been dealing with here recently, someone at the doctor's office, they didn't sign her signature, but they wrote her name in that blank where the signature was supposed to go. So, of course, that makes that null and void because she did not sign it, and the beneficiary was telling me I never saw advanced beneficiary notice of non-coverage. They didn't have me sign one, anything like that. So if you're wanting to know more about the advanced beneficiary notice of non-coverage, if you've got the Foundations Manual that I sent you, it's actually on page 53, and that just it explains what the advanced beneficiary notice of non-coverage is. And I said this is something that providers are supposed to give beneficiaries if they know that Medicare will not cover that service. For example, plastic surgery. Medicare usually doesn't cover plastic surgery. So they're supposed to give that to a beneficiary before they ever perform the service. And it gives the beneficiary a choice of, okay, yes, I know. And beneficiaries are never supposed to sign a blank one. Do not sign a blank one of these. It's supposed to be filled out with what the service is, how much that service is going to cost, and then it gives 3 boxes for them to check as to, yes, I know that Medicare doesn't cover the service, this is how much it is, and yes, I still want this service. One of the boxes is, yes, I know Medicare doesn't cover the service, but I still want the provider to submit the claim to Medicare. And then if Medicare denies it, then I will pay the rest of it. And then the last box is, no, I do not want this service. But it's very important for beneficiaries to not sign a blank one of these. It needs to be filled out. So that's why it's very important for beneficiaries to, read their summary notices. This is how they can detect the fraud. So when I go out and talk to beneficiaries, I tell them, prevent fraud. Don't give your information out over the phone. Detect it by reading your summary notices. And the last thing is to report it. If you do find something, they need to report it. So that's the three words that you all need to remember: prevent, detect, and report. Okay, so I'm going to go on to what is the difference between fraud and abuse. So, of course, Medicare waste then encompasses a whole lot of different things: the fraud, errors, and abuse. Now, of course, for years, scam artists have treated, Medicare like it's a automatic teller machine, drawing money out of the Medicare trust fund for their own benefit. There's a lot of providers out there that get millions from fraud. So what is the difference between Medicare fraud and abuse? The difference between fraud and abuse is actually intent. Fraud is intentional, and actually abuse is not. Abuse could be some of these like billing practices that they didn't know that wasn't fraud. But the problem with some of these billing practices is that it can actually turn into fraud if, like, Medicare has gone in and said, okay, you're billing this wrong. This is abuse. This is how you're supposed to bill it. And then after that education, if they still continue to bill it the old way and not how Medicare told them to, that actually turns into fraud, because then it becomes intentional. So abuse can actually turn into fraud. That's like I had one provider, they were kept balance billing the QMB even after me educating them. And I educated them several different times, and they still kept balance billing QMBs. And finally, I had to put my foot down and said, I'm going to have to turn you in for fraud, because I've educated you as much as I can. I can't do anything else. So I turned them in for fraud. So here's the definition of abuse. It's payment for items or services where there is no legal entitlement to that payment, and the provider has not knowingly and intentionally misrepresented the facts. And of course, the definition of fraud: knowingly and willfully executing or attempting to execute a scheme or ploy to defraud the Medicare program, or obtaining information by means of false pretenses, deception, or misrepresentation in order to receive inappropriate payment from the Medicare program. So here's some common examples of fraud that I have actually dealt with. Billing for services or supplies that's never provided. I deal a lot with those with like diabetic supplies. The beneficiary orders them, they never show up, and then they get their Medicare summary notices with those supplies on them. The other, and here's the opposite of that sometimes, is providing unsolicited supplies there was at one time a couple of years ago where beneficiaries were getting all sorts of different phone calls from these companies trying to sell them diabetic supplies, even though they weren't diabetic. And some of these supplies were actually showing up at their houses where, I mean, they hadn't even talked to anybody about diabetic supplies, and they weren't even diabetic. Misrepresentation, that can be a whole different things. I've had agents tell beneficiaries that they work for Medicare. Of course, all these scam calls that we're getting, there's several different scams going on right now of callers claiming to be from Medicare. One of the scams right now is regarding the new Medicare cards. They're claiming to be from Medicare and needing their, current Medicare number so that they can issue them their new Medicare card. The other scam that's going on right now is they're claiming to be from Medicare and wanting to know about their pain, back pain, knee pain, whatever kind of pain that is. And then they'll send them braces or, back braces, the knee braces, that sort of thing. So that type of misrepresentation. Prescribing or providing excessive or unnecessary tests. This example I've given before, and some of you may have heard it. I had a gentleman call me to report fraud because he had went to the ER for a cat bite. His cat had bitten him on the hand, and it was getting infected, and so he went to the ER. Well, when he got to the ER, they were ordering him a chest x-ray. So even though he didn't have any breathing difficulties or anything like that. So that's some of the unnecessary tests that can be provided. Violating the participating provider agreement. If someone is accepting Medicare, then they have a contract with Medicare, or it's called a participating provider agreement or a contract. And in that contract, it says that, they will not balance bill, QMBs, that they will only charge, Medicare or this amount, and then, they only charge the beneficiaries of 20% unless that beneficiary has a supplement, that sort of thing. So those contracts are very complex. Offering or receiving kickbacks or bribes in exchange for a Medicare beneficiary's number. Any type of kickback. We've had kickbacks from where a doctor is getting kickbacks from like a durable medical equipment company because they were sending all of their clients to this one Medicare durable medical equipment company, and they were getting like $100 per client that they sent or whatever. So that's an example of that. The next one is requesting Medicare numbers at educational events. Now, no one is supposed to ask for Medicare numbers at educational events or in unsolicited phone calls. And that's one of the reasons I tell beneficiaries, do not give your information out to anyone on the phone that calls you. Don't give your Medicare number out if you're going to health fairs or anything like that, especially if they're saying that these are free health fairs where they can get free services. Then they should not give their Medicare number out at those events. Another thing that I've seen happen sometimes is routinely waiving that coinsurance and deductibles is actually part of their participating provider agreement, that they have to charge beneficiaries that coinsurance, that 20% and their deductibles. And I noticed on there, they actually can waive some of those sometimes. They just can't routinely waive it, like forever. They can't advertise it that they're waiving those. They can do that on a case-by-case basis. For example, if they know that this beneficiary, like just started Medicare, doesn't have much money, and they know that they doesn't qualify for a supplement, that's up to them. If they still have to bill them, but they don't have to collect that money from them. And they can't do that routinely. It can only be done on like a case-by-case basis. So here's some examples of situations where it may not be fraud. And I've had to explain this to some individuals before. Because, Medicare is so complex and there's so many different billing code or codes out there and things like that. So it could come down to a coding issue, like they've coded something wrong or anything like that. So some of the things that can actually be fixed. And some of it is just the beneficiaries not understanding Medicare and how Medicare works and what Medicare actually pays for. So some of these is beneficiary claims to have not received a service or does not recognize a provider name. That, for example, I had to explain to one little old lady not too long ago what a radiologist was. She didn't realize she had fallen and broken her hip, and she got her Medicare sermon notice in the mail, and she'd never seen a radiologist. She didn't know what the radiologist was. And I had to explain to her what a radiologist actually did, that it was the person that actually read her x-ray from her hip. And she was fine with that after I explained that to her. As I said, there's next one is higher duplicate charges on hospital inpatient bills. I highly encourage beneficiaries, if they can, to get a itemized statement from the hospital or provider. It will help them, keep track of everything. And here's the situation I've dealt with not too long ago, is Medicare didn't pay for a skilled nursing care. And that situation was that individual did not have those 3 midnights as an inpatient in the hospital before she was transferred to the rehab facility. So that's why Medicare did not cover that, because she did not have those 3 midnights as an inpatient. Now, she had been in the hospital for 5 days. 3 of those days was there for observation. The last 2 were as an inpatient. So that's what threw her off. And yes, that is legal, that hospitals can actually do that, and I've checked into that. I hate that they can actually do that, because it really messes up some of the beneficiaries, because they think if they're admitted, they think they're in there as an inpatient, and that's not true. And that's what one of the reasons her husband kept saying, but she was admitted. Yes, she may have been admitted, but she was admitted as an outpatient under observation for those first 3 nights. And then those last 2 nights, they changed her to an inpatient, which the hospitals can do. I don't think, that's something that I think really needs to be worked on. There's still some confusions between the inpatient and observation. And I know Medicare's trying their best to do better education about that. But just because someone's admitted to the hospital does not mean that they were admitted as an inpatient. So keep that in mind. And that you may have to use your Medicare, your SHIP Medicare backdoor number to find out if they were there as an inpatient or an outpatient to see if there's an issue with the bill. And of course, fraud affects everybody. It affects, taxpayers, the Medicare Trust Fund, and anything like that. So that's why it's very important for the SMP program for us to get out there and educate as many beneficiaries as we can. And believe it or not, there's actually beneficiaries can actually get, if they're the very first one to report the issue to the Office of Inspector General, they can actually get money. If they ever get if anything ever gets recovered, or if it gets prosecuted, so they can actually get some money. So that's another reason why it's very important for beneficiaries to report it. So as you can see, Medicare loses billions of dollars every year due to fraud, waste, and abuse. And of course, right now with this, if someone gets their Medicare number stolen, I have to report that as compromised. Because it is their Social Security number or someone's Social Security number. They can also fall victim to identity theft. So there's other steps that they need to take to protect their identity if they get their Medicare number stolen. So this is some of the reasons I highly encourage beneficiaries, please, please, please protect your Medicare number. Don't give it out to anybody over the phone that calls you claiming to be from Medicare, because Medicare does not call people. Protect your number, treat it like a credit card. So do we all need to take a break, or y'all okay? Okay, I'm not getting any responses. Okay, I've got a question. Kathy? Can you unmute yourself?
I was just going to say I'm good. Keep going.
Oh, okay. Okay, keep going. Okay, I can keep going. All right, we can do that. Okay, so on pretty much to chapter 4. If my thing will let me here. All right. So pretty much during chapter 4 is what I'm going to teach you is some of the different types of Medicare fraud and abuse that I have dealt with before. So, as you said, I do submit all my fraud complaints to the Office of Inspector General. And there's a hotline that people call if they don't want to come through the Medicare, the SMP program, that is fine. As long as they get it reported to someone, that's the very important thing. They can report it by, calling 1-800-Medicare, or of course if they want to stay on.
Sorry, there's some, I can barely hear you. There's some background noise.
Okay, let's see, we're probably going to mute somebody. Jeannie, can you mute the person that's causing all the background? Is it Kathy? Kathy, can you mute yourself?
I thought I did. Can you hear me?
Yes, I can hear you.
Oops.
All right, there we go. All right, is that better? Okay. Thank you, Kathy. All right, now, as I said, it's very important for seniors or Medicare beneficiaries to report it, and it doesn't matter who they report it to, just as long as it gets reported. Of course, I would love for them to come through the SMP program. That would help my numbers, but they don't have to. Of course, I can help them gather up their information and things like that, what needs to be submitted. But they can report it by calling 1-800-Medicare. They can report it to, if they have an Advantage plan, they can report the fraud to their Advantage plan. Advantage plans have different, I guess, ways of doing that. So they need to, follow their plans, guidance on doing that. But they can report it to their Advantage plan. They can actually report it to the OIG hotline themselves if they want to. And there's a toll-free number for the OIG that they can find, or I can help them find it. And of course, they can report it to me. But the important thing that I need to stress, it just needs to be reported to someone. And I hate to tell you this, but if they do call 1-800-Medicare, and this has happened a whole lot of times, I get all these calls. So I've called 1-800-Medicare, and they told me to call you. So just FYI, if they do call Medicare, they may have to. Medicare may tell them to call the SMP program. Okay, so this is how CMS handles complaints, and it's very complex. Of course, CMS also turns over their cases to the OIG, just like me. But keep in mind, CMS may not help them gather up all their information and things like that. But we report our cases to the same entities. So how does the OIG handle complaints? Is it actually, if it goes to the OIG, it actually turns into a criminal investigation. So pretty much once I hand it to the Office of Inspector General, they shut the door on me. I don't know anything else or cannot find out anything else about that investigation. The only time that I can find out something is if it's in the news. If it pops up like this doctor was prosecuted, or they're prosecuting this doctor for fraud or whatever, that is the only way that I'm going to find out if anything happens to this case. Because like I said, once I hand it off to the OIG, they pretty much shut the door, and that's actually to protect the integrity of the investigation. They don't want the provider to find out who reported that. So that's why they shut the door pretty much. So they don't want to know who the beneficiary, they don't want the providers to find out who the beneficiary was. They don't want to know that, they don't want the providers to find out that it was the SMP program that it came through. So that's why they pretty much shut the door, is to protect the integrity of the investigation. Now keep in mind, These investigations can take years, and they do take years. It's because it may not just be that one beneficiary that reported to SMP. It could be multiple or, multiple beneficiaries that this happened to. So it takes years for them to gather all this evidence, because pretty much everything else after we report it and they start their investigation, everything becomes evidence. So they have to gather all of that before they ever go to seek either charges or prosecution. And sometimes even after they get them charged, it could be years before they ever get prosecuted. It's just because the legal system takes so long and there's so many hoops that they have to jump through before anything can get done. So I'm going to skip some of this. Most of this I've already been through. So here's some common scams that I deal with on a daily basis. Of course, as I told you, the Medicare card scam, that is happening right now. I get several reports every day, pretty much, of, they've gotten a call from someone claiming to be from Medicare, asking them, for, their old number so that they can, issue them their new number. And I've even had a couple of beneficiaries that I actually given them their old numbers, so I had to report those numbers as compromised. So please, 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 as much education as we can get out there about this scam, it'll save some beneficiaries. Anytime there's any changes to Medicare, especially during open enrollment or before annual enrollment starts, there's all sorts of scams associated with that. So I just tell beneficiaries, please, make sure that everything is legitimate before you sign up for anything. Make sure it's legitimate. If you get calls from, claiming to be from Medicare, it's not Medicare. So anytime there's any type of changes to Medicare, there's usually a scam that goes along with it. So here's the services, some of the examples of the services that I deal with on a daily basis. Billing for more miles than was actually traveled. I had one where the beneficiary only lived like 3 miles from the hospital, but when they got their Medicare summary notice in the mail, the ambulance services charged 30 miles, 30. So of course that was actually, it wasn't fraud, but it was a mistake on the part of the person that submitted the claim. So that was corrected, but as long as we can get it corrected, is no big deal. The part is, the fraud part comes is when they're not willing to correct that mistake. Durable medical equipment, as I said, there's that, fraud scam going around right now where they're getting these Medicare beneficiaries are getting these calls claiming to be from Medicare, asking about their pain, or sometimes they won't even say that they're from Medicare. They'll say they're from some other type of entity, wanting to know about their back pain or, things like that. So there's all these sorts of types of scams going on. Sometimes people's just getting back braces in the mail and they have never talked to anybody or anything like that. So I highly encourage beneficiaries, if they are needing some type of durable medical equipment or supply, talk to their doctors and go through their local DME companies, because there's, several local DME companies out there. Instead of these people, the ones that we're getting issues from are not from this state. Like the durable medical equipment that I've been dealing with here lately with these scams is actually coming out of California. So just keep that in mind. If they do need something like this, I tell beneficiaries, go talk to your doctor. They can write your prescription and suggest, some local DME companies. Home health, there's always fraud in home health. I had to turn in one CNA the other day who was going out to the beneficiary's home and calling in like she was there and then leaving. She was not providing the beneficiary any services whatsoever. So, of course, that got turned in. Things like that, billing for visits that weren't provided, billing for services to beneficiaries who do not meet the homebound criteria. Now, I think Sydney may have went over, those criteria that they have to meet to be considered homebound. And there's only certain places that they can actually go to meet the homebound criteria. Hospice care, some of these is falsely certifying a patient is terminally ill. In order for them to get hospice care, they're supposed to be within 6 months of dying. So sometimes there's doctors that can falsely certify that, or I've even had hospice providers actually falsely certify that the beneficiary was terminally ill when they really weren't, and just trying to get them onto hospice care so they can get that money. Another one is inflating the level of care, pretty much making the patient sicker than what they actually are. Because the sicker the patient is, the more money that they can get. Medicare Advantage plans and prescription drug plan marketing. Now, there was just a webinar the other day, I think on Tuesday, that I missed, that had the do's and don'ts of what agents can and cannot do, or prescription drug plans can and cannot do, pretty much during open enrollment. I know the SMP Resource Center will be having that on there, so if you want to go in, and you can actually go in the SMP Resource Center and get into the SMP library, but you have to you have to request your own account. So if you go in there, the SMP Resource Center, and have the SMP library on there, if you click on that and set up your own account, I can approve that account. Just email me and let me know that say, hey, I submitted, to try to get into the SMP library. And it has pretty much all these webinars that we have done. The one that they did the other day was the do's and don'ts of, Medicare marketing. And it's a really good one probably to watch, especially since open enrollment is coming up. Because there's a lot of things that beneficiaries can and cannot do during open enrollment. And most of those actually start on page 86 of the Foundations Manual, if you've got it in the mail. Some of the things that I really go over is, agents cannot go door to door, knocking on doors, or putting up flyers on doors to try to drum up business. They cannot cold call individuals. Now, one thing that has changed this year is that Medicare is actually letting the Advantage plans email everybody, but there has to be an opt-out in that email where beneficiaries can opt out. So keep in mind, and these are the guidelines change every year, so they change things a lot. So the very important things is to remember that no door-to-door, no unsolicited door-to-door contact, no unsolicited phone calls. So agents can't just be going door-to-door and calling people just to try to get them to sign up for the Advantage plan. But I highly encourage you all to read these. It's pages 86 through 90-something. 86 through 90, and this is it's got the do's and don'ts of what agents can and cannot do during open enrollment. Because I can, and I'll probably be touching on some of these during our statewide conference. Nursing facilities, we've had skilled nursing facilities. I've even had skilled nursing facilities where they documented that they checked on a patient or saw a patient, but they never did. I've turned one of those in before. Prescription drugs, right now there's a big opiate, epidemic. So I highly encourage beneficiaries, count your pills before you leave the pharmacy. Make sure the pill is supposed to be what you're actually getting. I had one beneficiary one time where he was supposed to be taking a certain medication, but when his doctor did a blood test on him, that medication did not show up in his system. So they don't know what the pharmacist actually gave them. If it gave him a placebo or what medicine he was actually taking, but it was not what he was supposed to have been taking. And that happens all the time. That's just, pharmacists can switch medicines. They can actually charge Medicare for, the higher priced brand name drug, but fill it with the generic. We've had pharmacists do that also. So just keep in mind, look at your prescription drug EOBs that you get from your Part D plans, or your EOBs from your Advantage plans, just to make sure that what is on the notice that they send from the pharmacist, that those are adding up. So here's how you can submit a complaint. If you have any issues or anything like that, you don't know if it's fraud or not, please don't hesitate to call me, email me, or anything like that, just about questions. That's what I'm here for, is to help support you all, because you are all out there on the front lines, helping, ship an SMP. So if you have any questions, don't hesitate to email me or anything like that. As I said, it must, in the packets that I have sent out, there's a copy of the SMP referral form in there and the release of information. In order for me to start a referral, I have to have the beneficiary's name, and information, so I can contact them. If I'm helping them with an issue, like a billing issue, I have to have that release of information signed. That way, they're giving me permission to help them with that issue. And it's to protect me from HIPAA, pretty much, because there's some doctor office that will not talk to me unless I have that release of information signed. So I'm pretty much done with my presentation. Does anybody have any questions? I'll open it up for questions now. Okay, Ms. Joyner, you've got a question? Sydney, can you? I don't know if that's out there.
I'm here. Sorry.
Okay.
Let's see. There was a question that came in that, Lonnie, you might be able to answer, or I can answer, kind of before your presentation started.
Okay.
So we used to do this, and I don't know, we could probably start doing it again. But a question was asked, do SHIP SMP volunteers get ID cards or identification during events?
Now, I know SMP, I do, I'm making a list right now of name badges, but it doesn't have like your picture on it. It's just got your name, and it'll have like SHIP, SMP, or team member on it. But yes, I do this, and I'm making a list right now to send to the person that gets that, orders those for me. So yes, I do send out. And usually I send them to the program coordinator so they can hand them out to you all.
Okay, perfect. Great. Thank you. A couple people had questions about packets being mailed out. I mentioned a little bit earlier, some people registered a little bit later, so definitely we weren't able to get mailed out packets to some of you all, but Lonnie, I will send you an updated list of everyone who registered. That way we can double check and make sure we're going to get everything mailed out hard copy to everybody. So we will definitely have that done. For me personally, it'll be by the end of the day tomorrow. Lonnie, I know you're out of the office, so it might take you another day or two to get that confirmed. Yeah.
So, but yes, I will get everybody a packet that did not get one prior to the webinar. And that's why I emailed out I actually emailed the Foundation's manual out to you all, the ones that I had prior to. So, any other questions? Ms. Joyner, I know you had a question. You had your hand raised.
Oh, and I'm going to unmute her now. Well, actually, I can't. Lonnie, can you unmute her?
Oh, okay. Let's see if I can. Okay. Let's see here. Oh, yes, I guess I can. Okay. Well, maybe not. No, it's not letting me.
Okay. Well, then I'm going to steal the ball back from you, Lonnie. So everyone's going to no longer see Lonnie's screen, and I'll see if I can unmute some people here. All righty, let's see. No. Not letting me unmute either. Isn't that nice?
Okay. Huh. Well, let me see if, nope.
Ms. Joyner, you might have to unmute yourself, but I think I was the one who muted you at the beginning, so I'm not sure how this is working. You might have to look into the chat box and type in your question. I apologize for that. We had a question come in. I had a question, Lonnie, if the slides that you just presented could be emailed to everybody. So if you wanted to send me your slides,
Yeah.
I can send that out to everyone.
Okay.
I will add that to my list to send out to everybody. Great question. Let's see. And I don't know why I'm not able to.
I don't know.
Maybe I have the wrong one. Nope. That's fun. Yay, technology. Always happens when we have to pass the ball to somebody else.
Mm-hmm.
Actually, yeah, I think I forgot. Lonnie, are you able to, let's see, it says connected, because I forgot to stop the recording when the,
Am I what now?
so I forgot to stop the recording. I apologize, everybody. We're taking just we're off topic a little bit. I forgot to stop the recording when I changed over to you. So let me see real quick if I can stop this recording. I don't know if I can.
Oh, no, you made me a presenter, I think.
I know. I was trying to get back to the original
Okay.
where I was. Well, I apologize for the... that's okay. Anyway, so are there any other questions for Lonnie before we kind of wrap up a little bit early, like I wasn't able to do yesterday, but apparently we're going to be able to do today? All righty. So since we don't have any questions, and again, please feel free, if you can figure out how to unmute yourself or type questions into the chat box, please do.
Or just email me. If you have any questions, please don't hesitate to email me.
Yes, that too, definitely. But before, oh, here we go, we got a question. If a Medicare number is used in a fraudulent way, what happens to that number? Will Medicare use their Social Security numbers?
Okay. With the new Medicare cards coming out, used to, Medicare could not issue a new number because it is based off someone's Social Security number. With the new numbers that are coming out, Medicare will be able to issue them a very new number along with the new card. So yes, they can actually change numbers once they get their new cards. But as I said, for the old ones, no, they could not change those because they were Social Security number based.
Great, thank you, Lonnie.
Great question.
Excellent question. And I just do want to reiterate what Lonnie said. If you have any questions about the training, please feel free to contact Lonnie or myself, and we're happy to answer any questions. But to wrap up today, so I hope nobody left, we're almost done, I promise. I'm going to talk about the exam again. So I hope if we've lost people, you hear the word exam and you come on back to me. I apologize, I've talked about this about 4 times, but just to put that final nail in the coffin. Once we end the webinar today, I will be emailing everyone who has turned in their volunteer paperwork, meaning your volunteer application and the 2 pages of the Volunteer Risk and Program Management Manual, or the VRPM, those 2 pages signed. I will send you the Level 3 certification exam. It is 45 questions long, multiple choice and true-false, just the basics of Medicare. Lonnie, do me a favor and mute yourself.
Oh, sorry. Well, I'm about to get off. So if you all have any questions, just email me. Thank you all.
Thanks, Lonnie. So 45 questions, multiple choice, true, false. And I highly recommend that you take that exam relatively quickly, either whether it's by the end of the day today or by the end of the week, just because the materials are fresh on your mind. Some of you may want to wait for some training materials to come to you, but if you have access to the PowerPoints that I sent, and I'll be sending Lonnie's PowerPoints as soon as she sends them to me, you should be able to pass the exam with no problem. You do get 3 attempts to pass the exam. And to pass the exam, you have to score an 85% or higher, meaning you can only miss 6 questions of the 45. But I know you guys aren't going to miss any because you've been paying attention. If you do, for some reason, miss more than 6 questions, what I'll do is I will grade your exam. I will send you a copy of your graded exam and a blank exam, and you'll retake it knowing what questions you got right and which questions you need to change your answers to. So I don't want this to be a hard thing to pass by any means. For those of you who have not gotten me your volunteer paperwork, most likely because you've registered here within this week and I just haven't been able to connect with you to get it or collect it, I'm not going to be able to send you that exam until I get that paperwork. So I'll send you a reminder as well, hey, I need this, this, and this, and then I can send you your exam to take and get certified. If you decide I'm not taking the exam, then you do not get certified. And I do have some of your contact information, so we really do want you to take that exam and get certified and get those credentials. We are accredited through Centers for Medicare and Medicaid Services, as well as the Administration for Community Living to provide this training. So that will be on your certificate. Once I get your exams, and everyone passes the exam, I'll send the exam PDF document as well as Word document. So if you wanted to take it and just highlight your answers and save it as a Word document, that's perfect. Or if you wanted to print it off and circle your answers and write notes and stuff, that's fine too. However you want to do it is up to you. Sorry, we had a question come in. Can you mail or email any applications or brochures that will be helpful during a counseling session? Absolutely. Feel free to shoot me an email and let me know if there's anything really specific you want me to mail you, whether that be MSP applications or LIS stuff. Anything you need that you need hard copies of, please feel free to shoot me an email and I will get you some copies out. When I get your exam and you've passed all your certifications, I will connect you to your regional coordinator in one of the 9 grand regions that we have across the state. Some of you may know who your volunteer coordinator is, or some of you need to be connected, and I will do that as soon as we get all the paperwork and all the lovely grant stuff all in order. So does anyone have any last questions before we kind of sign off and I give you a test to take? All righty, well, if there's no other questions, then you all are free to go, and thank you so much for being with us today. We really appreciate everything that you are going to do and have done so far to help SHIP reach so many people, and we look forward to working with you in the future. And like I said, anytime you have any questions, please don't hesitate to ask, and we appreciate you so much for taking the time out these last couple days to learn about Medicare. You guys have been awesome. Thank you so much. I'll be here for another couple minutes closing things down, but I should have the email and everything to you guys by 3 o'clock Central Time this afternoon.
Thank you.
Thank you, guys. Have a great night.
Thank you.
Thank you.
You're welcome. Thank you.
I hope she got all my paperwork. I'm not sure.
Who is that, Matt? Oh, is it Miss Joyner? I did get all your paperwork. Yes, ma'am.
Okay, so I'll get my exam. Thank you so much.
No problem. And if I don't have something, I'll let you know. But I'm pretty sure I have all your stuff.
Okay. Have a good evening. Thanks.
Thank you. You too.